will miss the beginning. So I'm waiting for the signal. Okay.
Okay.
Great. We're about to go live, guys. Great.
Well, actually,
Good.
No, I think it's a play on.
Thank you very much. Welcome. We're just now underway. So thank you all very much indeed for coming to the World Health Organization Pavilion. We're kind of adorned by this amazing sculpture of the lungs as a kind of reminder of one of the worst climate impacts of climate change, of air pollution, the terrible situation of asthma, particularly for young children. Thank you all very much for coming. I'm trying to get the positioning of the mic right here, but I will crack it during the course of the next hour. I'm going to quickly introduce our panel. John Balbus has come from the US administration. He's in charge of the Office of Climate Change and Health Equity, which is a theme we're going to be picking up on. Her Excellency Toyin Saraki, former First Lady of Nigeria and founder president of the Wellbeing Foundation Africa. Vanessa Carey, it's great to have you with us from Seed Global Health, doing important work again in Africa. Maria Nera from the World Health Organization, familiar voice to and face to many people because of COVID, but obviously a great advocate for action on climate change. And Jay Shroff, CEO of UPL Limited from India, among many activities you're involved in telemedicine, which I think we might, I hope, get a chance to touch on. I was a BBC news reporter for many, many years, covering climate change, and I saw for myself many profoundly upsetting health impacts of climate change. It was easy to become cynical about whether climate change was that serious. When you see it for yourself, the impact on young kids, the impact on farmers, the impact on healthcare workers themselves, struggling in really difficult conditions, you realize that health needs a much, much higher profile at events like this, COP27. So I'm really pleased on a personal level to be here in the WHO Pavilion looking after this. Let's first of all just do a quick geographical sweep of health impacts of climate change. John, I'm just going to start with you. You're at the end there. Perhaps you could grab the mic. In the United States, now obviously it's the world's richest economy, but there are great income inequalities, and therefore I guess inequalities in terms of health impacts of our increasingly hostile climate. What for you is the most powerful, moving example of a health impact in your own country?
Well, the United States is a very large and very heterogeneous, diverse country geographically and ethnically and demographically, so there are many different kinds of impacts. I'll just say, just in the last year, we've had devastating heat waves, we have had hurricanes by much warmer waters of the Gulf Coast, strengthening quickly, slamming into Florida, knocking out health systems. We've had devastating wildfires the last several years in the West. All of these have their population.
It's tricky to get it right. Yeah.
That affect populations differently. So, the wildfires are causing cardiovascular disease, deaths from heart attacks, hospitalizations from asthma. The hurricanes are causing a suite of health effects, many due to the loss of access to healthcare systems. So there's many different health impacts going on there related to the strengthening of extreme events. But Alaska, where we have the erosion of the coast and the melting of the permafrost, we have the migration of fox species, bees, a whole host of not extreme events, but the kind of slow, small-scale events of climate change devastating the indigenous peoples of Alaska.
They keep adding to pressure. So thank you for that.
Compounding their
so
health.
We're going to leap from America to India. Jay, give us a snapshot of your impression of what climate change in India means for health.
Yeah, thank
you.
You
just come through that terrible heat wave earlier this year.
That's right. No, I think climate change is causing huge impacts on health from different aspects. One is, the farmers burn crops, and that causes the same sort of impact you're talking about in the U.S. When there's stagnant water and excessive floods. It causes different diseases and mosquito-led malaria and waterborne diseases, and these are huge impact. But the most important aspect of this is that the remoteness in a country of 1.4 billion, the infrastructure needed has to modernize, and that's where we get involved, and as organization dealing with small farmers around the whole country, we get involved, and we are more and more concerned about the health and well-being of the families.
Okay, thank you very much for that. Let's leap now to Africa. Toyin, take the mic. Give me what for you is, if you like, the most compelling example of a health impact of climate. Yeah, I think just hold it really close. I've tried to learn.
I'm going to just look at Africa in 2022. This year so far, we have lost over 4,000 people to death from extreme weather, and over 19 million people are displaced in Africa due to climate change, directly due to climate change. Now, in Nigeria, in the last 6 weeks, 600 people have died from the flooding, and another 4 million people have been displaced. And of those who are still trying to shelter in place, they are having to use flood water that's contaminated sewage as cooking water, as bathing water for their daily needs. So we know we're going to have a cholera epidemic, but we don't have the infrastructure to even rescue the people who are in areas, let alone the supply chain that is required to ramp up cholera immunization. So for me, what I would say is that the immediate impact of climate change is it weakens social service delivery, quite weak system. So when we say investments, we're not talking about, thinking about what we invest in 2030. We're talking about the action, the humanitarian resources that need to move quickly to where they're needed and then need to be integrated within the system. Because these things happen every year. We can't keep acting surprised each time a dam bursts bank.
And we know it's going to happen more often. I tell you what, do hand the mic to Vanessa, but Maria, let me come to you next. Now, one of the most heartbreaking impacts is on healthcare systems. Of these extremes, as Toyin's saying, the pressures on healthcare delivery, the sheer difficulty for the doctors, the nurses, the hospitals to function. From your WHO perspective, what does that mean? To what extent are these pressures growing? How critical is it as an issue for you?
Thank you. And you heard already what climate change is doing to the health of our people. So the people who is taking care of the health of our citizens is normally the one on the front line. You will have always a very peripheral healthcare facility trying to function, and those are the ones that are already perceiving the increase on the certain diseases that they didn't see before. I mean, we have places in Kenya that they didn't see malaria before because of the altitude, and now they see it. We see more and more cases of acute diarrheal diseases, and therefore, again, the front line of the healthcare facilities. But if you add that, the fact that in a big percentage of healthcare facilities in Africa, there is no access to safe water and sanitation, believe it or not. I mean, a healthcare facility where you are supposed to take care of the health of the people and you don't have facilities to wash your hands. So this is now with the water scarcity, in the fact that the resources are allocated somewhere. I mean, if we solve that problem of access to safe water and sanitation and hygiene and electricity for those healthcare facilities, electricity with solar panels, of course, to make it less reliance on diesel or that are using at the moment. So if we can achieve that, part of the problem will be already solved. So we need to start to invest in those healthcare facilities to make it more climate resilient and to have the resources to be adapted and cope with the problems that they are already facing on an incredible way.
So climate change exacerbates the already challenging role of healthcare providers in many different ways.
Well, the health sector has never been a rich one, to put it that way. Even in the rich countries, you know, normally there is the orphan, and it's considered as a kind of expenditure instead of an investment. So imagine now, with all the challenges they have, with the water scarcity, the increase on those diseases that are caused by the transmission of vectors, the natural disasters that are putting them at risk, that is exacerbated and creating a situation that is really putting at limit the resources of the healthcare facilities.
Well, thank you. And Vanessa, from your perspective, obviously, as you said about your work, you face all kinds of challenges. To what extent is climate becoming one of, if not the biggest factor or obstacles to what you're trying to create?
So Seed Global Health, Sub-Saharan Africa, to help build the healthcare capacity that is deeply critical to responding to all diseases. And for us, with climate change and the fact that already 80% of all global deaths are related to some kind of climate event or related event, and we're going to see an extra 250,000 deaths a year from climate change every year, additively. Healthcare workers are under increasing pressure. There's increasing need, and when you already have a global shortage, and then you're going to put even more disease burden on that, and a lot of that chronic disease, you're just careening towards a crisis. So climate and health are deeply interlinked, and in some ways, they're the same existential problem. We are talking about our human sustainability. And both are needed for us to be able to go on and to thrive. And if you think about the fact that someone's main asset is their ability to work, if they get sick, they can't work. They can't go make livelihoods. They can't participate in their global economy. They can't take care of their children. And if climate change is going to be a as well in our future on this earth and all of our resources, we're still talking about the same problem. So at SEED, we feel we have to accelerate the work we are doing together, accelerate the investment in resilient health systems and in the workforce, because healthcare is fundamentally a human-centered intervention. Technology is not going to solve the problem if we don't have the people to leverage that technology and to meet the disease. One example, and then I'll finish. If you look at Ebola in Uganda right now, there's an outbreak of, I'm really close. Okay. There's an outbreak of Ebola in Uganda right now, which has been spreading, and it started in a rural district where there were not enough healthcare workers to be able to identify what was happening and stop it in its tracks. Yet, the government, being proactive and having seen Ebola before, moved and concentrated some of its cases towards where there were healthcare workers, and they started treating. Mortality for Ebola when healthcare workers are present is down to 40%, when it has traditionally been 90% in these settings. That is what happens when we empower a workforce to do its job. Sorry, I feel very passionately, and I now have a microphone that works. Thank you.
No, it's very good to hear that. I think this one might be good. I'll send that one back if I may. I wonder whether we could just share some thoughts about, given this extraordinary, terrifying, profoundly upsetting landscape that you've all described, why this topic doesn't get more play at COPs. Maria, do you want to pick that up? I mean, my first COP was COP11. I think that was yours as well. What is it that's held the process back from engaging more, given what we're hearing?
I've been attending several COPs, that's true. And the first ones, it was really painful. We were running around after the president of the UNFCCC, telling them, hey, health is important, come on, give us some space. And they were treating us like, you're nice people, yes, of course, health is nice, but keep quiet and come on, leave me do my work. And with the years, WHO started to convene a group of health community. John, you are one of the first to join us as well. And today we are very happy that there is a very, very strong network of health community that took us here to bring the lungs to the center of this. And this is just to the beginning. They will hear about us, believe me, trust me. They will see those lungs very, very often on their lives, because we will inundate them with pictures for them to remember that this is all about human health. Don't forget about the lungs. It's not just to the lungs, it affects all of our body, but at least think about the lungs. You cannot stop breathing. So maybe this will give the message of urgency. But let's do it in positive. I think the health community is the one that can now, on a very pragmatic way, say, okay, let me take care of this and tell you what you need to do and do it right now, because this is very urgent and we are on an emergency room at the hospital and it's under our control. That's what I would like to see.
Great. John, I'm going to hand you the mic in a second. What do you think it would take to raise the profile of health in the climate context, which I think we'd all agree it hasn't had the position it might deserve?
I would point to two things. It's very true that the climate community has been slow to take up health, but I think as a member of the health community, we have to also acknowledge that the health community has been slow to take up climate. That people who are on the front lines of healthcare have felt that they have a patient in front of them, emergency in front of them, and that climate change was somehow something that was going to happen in the future. Don't bother me, it's an environmental issue. I think that narrative has changed in the health sector, in part because of the devastating sequence of extreme events that have taken place all around the world, as well as the COVID pandemic, which has shaken us all up, and these things have co-occurred. So now that the health sector is mobilized in the mainstream, I think that will help to bring the message much more effectively to the COP. But the second thing, and what's happening in the mobilization of the health sector, is that it's not just about saying that that climate change is hurting our health, but it's also the acknowledgement that the health sector is a major source of greenhouse gases. 5% globally. In the United States, it's at least 8.5%. And as the health sector mobilizes to become part of the solution to climate change, I think that the doors will open and the ears will open in the mainstream climate policy folks in the COP.
Thank you very much for that, John. And Toyin, I want to ask you what you think in a way has been the blockage. What's been the barrier? I mean, the stories you've all told are so powerful, and they're not in a way new. I mean, many of us who've been reading this or reporting on it for years have known this stuff. Politicians must have known it. What do you think has slowed it all down?
You know, coming from Nigeria, well, the Wellbeing Foundation actually insists on implementing daily programming. We don't wait for a disaster. You know, we have an army of over 50 midwives and nurses who are out at over 570 health centers in about 8 states every single working day. But even from our perspective, we were just doing health, safer childbirth, health, you know, personal, social and health education for adolescents and school children. And it was in 2018 when I suddenly saw, you know, we were doing water sanitation and hygiene, but we were just doing it for infection prevention and control. We weren't doing it intentionally to intersect with climate. And I was wondering, you know, we'd make a little bit of progress and then somebody else would come into power, lose the political will, the progress would wipe out. And then I saw a report in 2018 that actually showed that only 22% of Nigerian health facilities had running water and soap, and only 12% of labor rooms actually had a sink in the labor room. And then there was another little survey that we did that told us that 78% of Nigerians had never heard of the word climate change, and they didn't understand it. So for instance, in Port Harcourt, and I know we've got a member of the audience here, they have got a 17% hole in the heart rate of newborn babies, and they have no idea that that is tied to the air quality or the poor air quality that the mothers inhaled. So we had to first look at ourselves. Instead of attacking the climate lobby, so to speak, we had to look at ourselves, and instead of doing our programming intuitively and instinctively, we had to do our programming intentionally. So we first went to the experts at Reckitt and we said, look, I said I need to take this little program that I'm doing in 40 schools to scale. I need to teach the young ones about the climate, about the environment, about how they can understand this and engage. Because, you know, with climate, you blame governments for not taking an action. With health, it's the patient that's blamed. Oh, you didn't do enough exercise, or you ate too much, polyunsaturated fats, or you didn't do this. And so we have to find a way to bring those two conversations together and to actually have a message of hope that if we intentionally program with these two things intersecting, even at the front line, it doesn't have to be just at the tables where we sit as decision makers and thought leaders and policy makers. We can take a mobile clinic to a farmer and also tell him how to grow better seed to get a better yield, to feed our future better. So it's about integration, it's about multi-solving. The days are long gone where the health people will sit in one room and the climate people will sit in another room. That's how I know Maria Neira, actually, because I just said, okay, the WHO as a normative body has actually led the world on intersecting these two things together. Now we need all the other sectors to come together, cross-invest, cross-program, and get what I will call the triple dividend or the quadruple dividend. But I'm not one of those people who says by 2030. The urgency is to do that cross-programming laterally now.
Thank you very much indeed. And I know, Jay, you've been involved in different projects, different programs that are endeavoring to provide better care for people perhaps in remote areas, in villages in India. And I'm wondering whether, as part of that work, are people noticing increased heat waves? Are they talking about it? Is it part of the project? Is it too soon to try to integrate these different agendas, as we've heard from Toyin? Or is it more just a focus on trying to get better care to people who need it?
No, thanks. I think one of the biggest looming crises today in the next 3 or 4 years is food security. And without health at the smallholder farmers level, without taking care of their health, food security is a fantasy. Because if you are not able to have healthy farmers who are able to function, besides the fact that they are impacted hugely by climate change and the risk of farming is farmers are so much more vulnerable today than they were 10 years ago or 15 years ago. And I think the other impact is healthcare, right? If we do not offer proper healthcare, proper nutrition, proper understanding of what is the problem they're facing, it is going to lead into so many other challenges. Like we have, Africa imports $50 billion of food. Now, if we need to have food security, health is an integral part of that, and for which at UPL we do many things, and we are piloting different projects. One of them is digital health, right? Telemedicine, where farmers pay $4 a year, or we pay $4 a year for farmers, and they get a 24/7 medical facility. This is a new business model for cities where telemedicine is a hot startup industry in India, and lots of investment, billions of dollars being invested. And when we went to the startups and say, why don't you cater to these millions of small farmers in villages who really need telemedicine, who have to go 5 hours to visit a doctor if they have a headache to find out, do I have a tumor or do I just have a headache? And so we are encouraging that. And in Ivory Coast, we've set up mobile clinics which go and do healthcare checkups for young children to really find out basically if they have some obvious health challenges, and can they be mitigated by small intervention, and if it's a big intervention they have to go to the cities, but most of it can take care. And it is surprising how much we can find and how much impact we can make, because without a healthy livelihood and healthcare, we're not going to have food security.
Thank you very much. Maria, are you finding that with the prospect of digital healthcare, that is one concern that in some parts of the world, well, some are blessed with great digital access, others aren't. Not everybody's got a phone, for example, or an iPad or whatever. I mean, is that a question of concern at the World Health Organization level, that amid this push for digital medicine, and I totally see the benefits when it works, and also the carbon saving that can be brought in here, but what's the WHO perspective on this? It's not for everybody, presumably.
It's incredible because if you go around the world, even in the most remote areas, you will find this, a mobile phone. You might not have the facilities to wash your hands at the clinic or to have electricity, but almost everybody will have a mobile phone. So we need to take advantage of that. And telemedicine can be one of those advantages. We can perfectly assist or provide assistance to people that before that was completely isolated. We can use it to reduce the carbon footprint of the health system. We can use it in a wise and intelligent way, which sometimes humans, they have difficulties on using things in a wise way. But this is, so definitely WHO is very much promoting digital medicine, recognizing that it can provide enormous advantage. We need to play as well with the issue of the personal contact with your doctor that many people, of course, appreciate, and never substitute completely the human contact that when you are suffering or you have a health problem, you will have to hear. So it's not we are not replacing the medicine, the human part of that with telemedicine, but definitely we need to take advantage of a technology that can offer us many results, including this decarbonization of the health sector that we need. But the thing as well is that if we have mobile phones almost everywhere, why we don't use it as well to educate our people, to provide more resources as well for them to have a better protection for their health, and to prevent maybe a crisis, a natural disaster, to give them some warning regarding natural disaster or flooding or alerts that can come. So we will use it as well for epidemic preparedness, for humanitarian disasters preparedness, and for warming and for alerting the people and giving the signals that they need. So all the positive aspects can be incorporated.
And in your messaging about digital health, telemedicine, and the way you frame it and describe it, do you also bring in a kind of carbon saving message, or is that a point too far? I mean, in terms of how we try to join all these different agendas up, is it an opportunity, if digital rises, to say, actually, in addition to it being useful if you're in some remote place, you're saving carbon, it's good for the climate?
We need to be extremely careful with the narrative. Okay, when we started to talk in WHO about decarbonizing the health sector, we were very conscious of that. We will decarbonize in the medium and high income countries, because those are the ones that are contributing to the carbon emissions. But you have many other healthcare facilities and hospitals around the world that not only they are not contributing, they need to be able to start to contribute. And we want them to have access to electricity by using solar panels, by using renewable energy that will provide them the access they need to electricity, but at the same time not contributing to that. So the message has to be incorporated on the pragmatic way. For rich countries, you will contribute to decarbonize because you are already having a carbon footprint. But for those poor countries that not only they are not contributing, but they don't have access, this is not the argument they want to hear. So, at the contrary, we need to accelerate their access to electricity for running the healthcare facilities in the health services.
Thank you. And is that your perspective, Vanessa, on this? And in the work you do, you're not going to be talking to a lot of people about climate risks. I mean, is it just inappropriate? Are there times, are there situations where trying to make the link, trying to provide an intersection just isn't going to fly?
No, I'm a deep believer that every conversation we have needs to be based in our well-being and our human sustainability. And therefore, climate, health, energy, green energy, job creation, gender, it's all married. These facilities that don't have access to energy to run their ORs or to keep their oxygen tanks on, those facilities should have oxygen. They should have energy, and we should be very clear. There are profound inequity gaps that exist in the world today that are unacceptable in 2022. So this is not about not investing in those communities. It's actually about investing in them. But those communities can be the leaders for the rest of us, because if it is green energy, if it is sustainable how we build them, then it's going to put the pressure on everybody else to start to follow that level. But I think it's incumbent on all of us to make sure these conversations are linked, because I know of a country in Africa that just got an MCC grant to do an energy grid. It's traditional. It's not solar. It's going to be the normal pathway forward. They're not linking it to make sure that their health facilities are going to actually be getting the kind of energy they need to save lives. And it's just a lost opportunity. And I think we all, the policymakers, have to think very carefully about how we can have an eye so that our solutions can solve multiple, solve for multiple opportunities at once. So I think it's a very constantly integrated conversation that we have to be having.
And that example you gave, I mean, I'm not going to ask you to name the country, but is the problem there that the people providing the finance haven't joined up, or that the government involved doesn't get it? Or, I mean, presumably there's a lack of joined up thinking on that particular example.
The government gets it. The government is under a pressure to produce a certain amount of results in a certain amount of time, and there isn't necessarily the support network to create that green energy at scale, which, by the way, could be job creation on a continent where 2/3 of the population is under the age of 25. So it really is a pressure from kind of the power structures that are age-old, historic, based in racism and colonialism and all of these expectations that get set by a certain agenda. And I think we have to be very thoughtful about how we have conversations again where inequity gaps shrink, where we are equalizing better, and where we are creating solutions that, again, will be very vested in well-being and human sustainability, because we are going to run out of time if we are not careful. And I think we still take that for granted.
Thank you. One of the big themes here at COP27 is finance, and the ongoing clamor from developing nations for a level of funding that was promised back in the Copenhagen summit of 2009. Those of us who were there, that was a bit of a car crash. The one thing that came out of it was this promise of 100 billion a year, which has not been delivered. Clearly there's now an ongoing debate about loss and damage. I think I sense an inching forward here, but probably not opening of the floodgates of money, because as we heard a number of G7 leaders say in the last few days, it's not the easiest time even for the rich nations, right? And there's a pushback in some countries, like my own, the UK. Foreign aid is not massively popular politically at the moment. In that context, what's the way forward? How does one create a narrative that suggests that there's no choice about this, particularly in relation to healthcare? John, do you want to pick this up? I mean, clearly the US is a great funder of many programs, but clearly it's also the world's number 2 emitter and the richest economy. The question is bound to come along.
Let me just start by making very clear that the office that I direct has a domestic focus and is not in any way involved in the funding of health activities around the world. So I'm not sure that I can speak with the most knowledge and authority in that, but I will say a few things. The first is that the Biden-Harris administration came in with a promise to increase its international funding, and it has done so. Second, there is a tremendous amount of support and funding that goes on year after year from the United States to, for example, support the provision of AIDS drugs around the world, to the Rollback Malaria Initiative, the Global Health Security Agenda. There's a tremendous amount of support, but as we've been saying all across this panel, for the most part, the structure of that, the policies, the guidance, the thinking behind that has not been thinking about how malaria or AIDS and the migration and all of the issues that PEPFAR deals with, or the global health security agenda, is influenced by climate change. So I think there's a lot of opportunities to find these synergistic solutions, and where we are contributing a lot of money into infrastructure, into global health, into all of the things that the money is going now, there's a tremendous opportunity to find synergistic solutions and really make progress on climate change as we're making progress on the provision of medications or other things that these programs are doing.
Thank you very much. And I was interviewing someone from the Bank of America the other day who said that while the public sector can unlock billions, it's the private sector that will unlock the trillions. And I'm wondering, Jay, from your perspective, I'm not saying you've got trillions at your disposal, but nevertheless, are there situations where you would be encouraged to make investments, for example in resilient healthcare, where, I don't know, seed funding or some commitment to some funding by a public sector body or other would make a difference to your decision making?
Absolutely. You know, as a company involved with agriculture and really the farmer at the center of our business proposition, we focus on farmer resilience. Farmer resilience is a key to, I think, development of anything, right? You talked about finance. Today, banks shy away from lending to small farmers because the risk is just too high and they are too far away from a small farmer to be able to even imagine lending to him. So I believe that farmer resilience through technology is key. So how do you catalyze sustainable farming? How do you catalyze income increase? So obviously there's a lot of talk about using carbon farming or carbon credits for sustainable agriculture. But I don't believe that governments will fund that. I think the food value chain should fund it. Today, with all the technology available, we can have traceable food. We at UPL are showcasing so many examples of sustainable cocoa farmers going all the way to chocolate manufacture with a QR code where you can see his farm. We're doing that with different crops around the world, particularly from smallholder farmers. And we believe that once you have traceable food, you will be able to reward farmers for sustainable behavior. Once you have better income, once you have alternative streams of income, so if a farmer can get another $20 an acre, another $30 an acre from carbon, another 5% better value for sustainable farming. Now once he has financial security, next thing he wants health security. So the next thing for sure he'll invest, he'll ask his local politician, he will ask whoever is responsible, saying, I need a medical school, I need a school for my kids. And I think that agriculture can catalyze a lot of investment, because today banks will go in and say, okay, you're a financially viable farmer, I will support you. And that will catalyze working capital and so many other things. So we believe that particularly in remote areas, agriculture can drive a lot. And with technology, all traceability is available. We're tracking farms through satellite. We're paying digitally to farmers. We're giving him insurance. We're doing so many things to enable them.
And all of that builds resilience, which improves health outcomes, ultimately.
Absolutely.
Yeah.
Absolutely.
Okay.
It helps investment in health income, because there is only so much amount of free healthcare you're going to set up in the world, right? You will set up whatever you have limits, and then it has to self-finance. So that has to happen. There will always be abject poverty who need it free, but to give those guys free, you need paying customers.
Maria, you, thanks for doing the mic. I mean, you mentioned the WHO is not blessed with resources, so it's not going to crack all the problems that we've discussed here. What's your sense about engagement with the private sector to maybe unlock the scale of finance that could lead to the kind of transformation that we're seeing?
Yeah, definitely. WHO is not a rich organization, but we have a very important goal in our hands, which is the capacity to convene. And we can convene the best experts from the world, and they can come to WHO and provide us this capacity of influence, and then use the limited resources we have on the most powerful way to influence. But talking about resources, yes, the private sector, definitely. That's why we need to have a very clear policy recommendations, influencing them on the way they will invest, on the way they shouldn't be investing, and on the way they should put the money to produce, on prevention better than cure. But let me give you an example. In terms of financing, if we start by do not harm, which is what in medical terms we put always up front, first, do not harm. The governments are still giving subsidies to fossil fuels. I mean, that could be already some funding, some financing that you are doing, but you are doing on the wrong way. Governments are still giving 400 billions every year to the fossil fuel industry, and in any of the reports that have been done to inform the COPs have been going for 27 years now. And there is a famous Stern report on the costing, you might all remember that. Never in those reports they consider the externalities for the health system. I mean, the cost that what the causes of climate change were already doing to the health system, and therefore the cost that the governments were putting already on the health system, which means that those externalities are costing us trillions. So when people use the argument, we don't have enough financial resources to tackle the causes of climate change, most of them will be already, a contribution will be already enormous, but not giving subsidies to the fossil fuels. And second, by calculating the externalities, the cost that the health system is already paying, keep in consideration that we are talking about chronic diseases, most of them. Those chronic diseases require a long-term hospitalization and care and follow-up, and that's very, very expensive for the community, for the society, for the governments, but they are never including that cost in all the economic reports that have been doing at the COP.
So it's a sort of missing calculation in really how society should be measured.
Ignoring completely that if you are giving subsidies to fossil fuels, that then the combustion of that fossil fuel is creating air pollution, and air pollution is causing chronic diseases, somebody has to pay for those chronic diseases. And that cost has never been included in any of the calculations.
I mean, it's one of the key factors, I think, that have undermined progress in so many ways, that this has not been factored in. Vanessa, do you want to come in on this point about how the private sector engages? Is that something you want to address? I mean, in terms of unlocking finance, in terms of scaling up, governments can't do it alone, particularly in a context where governments are feeling the pinch.
Absolutely. I mean, I think at the end of the day, I agree with the statement that private sector is going to unlock the trillions, and they're going to accelerate the rate with which we can create change. The question that I have is that going to be responsibly done? And is that going to be done equitably minded? Private sector can make a profit. They're designed to respond to their shareholders. But I think we have to ask ourselves very candidly how much of a profit and at what cost. Because at the end of the day, a lot of that profit can either be slightly smaller with incredible social good and a lot less pressure on the world, or it can be maximized, condensed. Oxfam, I believe, came out with a report that said 22 billionaires have all the same wealth as all the women in Africa. That is just disproportionately. 22 billionaires have consolidated wealth the equivalent to all the women in Africa. That is a continent of 1.2 billion people, so half that, roughly. That is unacceptable. And I think that I think there's a huge role for private sector. Government is also important because they will provide the safety net, but private sector can accelerate the progress that we make, and we have to do this in partnership. I fully want to endorse, though, the point that Maria Nera made about not taking account the savings. For every dollar we invest in health and changing in health outcome, there's $2 to $4 in return on investment. There could be 4.4 trillion by 2040 that go increase the GDP of developing countries if we actually made those health investments in those countries instead. So I think we really have to see this as a positive investment, not as a cost on our system.
That's a great setup for my next question for all of you. So as we're kind of into the final kind of minutes really of the session, I'd like you all just to cast your minds ahead. Let us say, and this is a nice idea, that we all get together in a year's time at COP28 in Dubai.
At the official health day?
The official health day, whatever. Let's see if health has a higher profile by that stage. What would you like to have seen happen? What accomplishment would you like to have seen occur? What profile would you like health to have in the context of the COP28 talks that'll happen in exactly a year's time? Who wants to go first? John, do you want to go first? Oh, Toyin, you put your finger. So just a kind of a...
Well, certainly what I will say is that, we've had these very frank conversations, and I'm an African. So, first of all, we're not going to be able to run away from the fact that Africa contributes only 4% to global emissions, and we're on the receiving end of all the loss and damage. So as we prepare for the next COP, I would like to see a financial instrumentality that allows the global north to make what I would call the reparative investments, but not in a punitive manner, in a forward manner, so that we all reach the same place at the same time. It should be part of our intentional plan. I've been a global ambassador for the International Confederation of Midwives, which actually supports more than 1 million midwives in over 47 countries. At the same time, I'm global health ambassador for the WHO Foundation, because the WHO is a very large and normative body, but felt it needed that flexibility to be able to go and help where it counts. And I have seen the private sector move into a world challenge on health and solve it. I was part of the Every Woman, Every Child initiative that started in the last 5 years of the MDGs. And together with the private sector, we moved over 80 billion of targeted investments to countries where it was needed. And when I hear, somebody says, 20 billionaires have more money than all the women in Africa. The women in Africa, we have a different cultural behavior. So we don't feel that the money needs to be in our account for us to have the influence over the decision-making power of how it is spent. And so what I will say is we must influence the world that we live in to deliver the results that we want: clean energy, equity, and health for all alongside the climate.
Thank you very much. That's a great comment. John, a final wrap-up wish list for a year ahead.
I certainly support the comments that we've heard, and at the same time, I think that what we've been talking about for the last 45 minutes, the need for the health narrative, the need for the involvement of the health sector in a meaningful way in the COP, is the start of the tipping point. And in a year from now, I would love to see that, for example, all of the countries that have committed to the COP26 health program actually send a health delegation from their health ministries and are involved and are present. And then I'd like to see also that those health departments are coming and articulating what we've been talking about, the health implications of the climate actions or the lack of climate actions of each of those countries. I think that's how we can start to change the narrative and move the needle.
Very much indeed. Jay, just a brief remark.
Yeah, what I would like to see is really focused. I'm a big believer in capacity building, and we are running a lot of projects. I'm sure lots of companies like us are running projects. Identify some of the projects and focus on capacity building. If we have 2 medical clinics, can we have 200? It's costing us $500,000 over 5 years. It's nothing, right? Nothing for the private sector. We could easily put 5 million, we could easily put 10 million, because in the end of the day, they are our customers, and we are taking care of their health. It is helping our business, and it is actually improving their livelihood.
Okay. Thank you very much. Vanessa, a final wish?
I would just like to see health be present in and understood as relating to every sector. Everybody's and everything that we're doing, to hear that come up in everybody's conversation, whether it is energy, whether it is politics, whether it is economy and economic growth. It needs to be present in all of it. And to that effect, I would like us to see us again prioritize a well-being agenda. We've articulated it. We know we're not making progress towards it, but we haven't changed our behavior for that yet. And I think that's what I'd like to see shift.
Fantastic. Thank you very much. Maria, we're in this amazing World Health Organization pavilion. I think we've all enjoyed being in the lungs. Give us your final remarks, just in a minute or so, what your wish list would be.
Look at the lungs again. They are infiltrating, so maybe we can use that image. I will love to see health infiltrated very strongly in all the sectors that there will be at the COP28. I hope that this little bronchia could go as far as influencing energy sector, economy sector, all the sectors, and all of them keeping in mind all the time how my interventions will benefit health, what will be the health outcomes that we will obtain from all of that. So I want a very strong representation, but for good, not just because we want to be everywhere. We want to make sure that health will be very strong, because that will give the sense of emergency, because people respond to their health problems, and that will be a positive message as well, a positive way to move. The health argument is very positive, is very engaging, is very motivating, and hopefully is full of common sense and pragmatic approach, so will be the one that will give the final push that we need to act more on the causes of climate change.
Maria, I knew I could count on you for a final inspirational set of remarks there. Thank you very much. Would you all join me in thanking a terrific panel? It's been a great pleasure. Thank you all very much indeed.
Yeah, a junior from BBC, but it's okay. For a junior was good.
Thank you very much.